So good morning everyone, I'm Dr. Savitri and I'll be showing our study on visual outcomes of latest software-based dichoptic therapy for amblyopia management. We don't have any financial interest. So amblyopia, as we all know, is a neurodevelopmental disorder affecting the visual cortex with no identifiable pathology of the eye or the visual pathway. There is impaired visual development in one or both the eyes. It impairs the visual acuity, the stereo acuity, the pattern recognition and reduces the sensitivity to motion and contrast. So early diagnosis and treatment is imperative. So first of all, to correct a refractive amblyopia, we have to cater to correcting the refractive error first by means of glass or contact lens. Then there is addition of either patching or atropine depending on the case. But obviously these also have their own set of problems like residual amblyopia, non-compliance, limited efficacy, side effects of the atropine therapy, and poor response in older children and adults. And also there is risk of relapse of the amblyopia after treatment cessation. So due to the shortcomings, we have binocular-based dichoptic therapy. It has come into limelight in the last few years. Studies have shown that the depth of amblyopia has been positively correlated to the degree of binocular imbalance. The affected individuals show impaired stereo acuity, abnormal binocular summation, and that the binocular cortical communication still persists in the subjects with amblyopia. So basically it is based on dual colors, the red and the blue separately for dissociation with the red for the amblyopic eye. Essentially it promotes binocular cooperation and increases the cortical plasticity. It offers simultaneous and separate stimuli to both the eyes with the dominant eye receiving an image of the lesser contrast. So this is when the images from the two eyes are superimposed, the subject perceives a single percept with elements presented to both the eyes separately. Literature has shown evidence that it improves the visual acuity, the stereopsis, and the binocular function also. The purpose of our study was to evaluate the visual outcomes of a 12-week dichoptic therapy in the amblyopic eyes. So we undertook this retrospective observational study wherein 35 patients were enrolled. Patients who had completed 12-week therapy regimen and consenting for the study were included, whereas those having coexistent severe ocular pathologies, unable to complete the 12-week regimen, or those who have had another type of amblyopia therapy done in the last 2 weeks and not consenting for the study were excluded. PAIR-T test was used for the data analysis. So BCVA, stereopsis by Titmus fly test, and binocular function by Wirth 4-dot test were assessed pre and at the end of the therapy. We have the Binox, which uses the anaglyph glasses, which has 3D stereoscopic effect. Regarding the therapy protocol, so patients having either unilateral or bilateral, both kind of amblyopia were enrolled. There should be no squinting, but at the same time, mild to intermittent squinting with good control is still acceptable. The patient needs to have a central fixation, and there should not be any neurological issue, and there is no age bar. Coming to the clinical evaluation, so a detailed history and complete ocular examination is mandatory. The therapy session consists of 30 to 50 minutes with a minimum of 5 days a week and total of 60 sessions. So both eyes are individually color calibrated first. The patient parameters like the IPD, refraction, distance and near vision are entered. Then there are different types of activities followed by assessment. There are different types of games, and this is how the final results look like. So coming to our results, out of the 35 patients, we found that 71% had anisometropic, remaining had isometropic amblyopia, whereas 23 had unilateral, that is 65%. The age ranged from 6 to 30 years with a mean age of 13 years. We found significant improvement in the mean BCVA from pre-op 0.5 to post-op 0.3 logMAR scale in the anisometropic group and from 0.4 to 0.2 in the isometropic group. The non-dominant eye showed significant improvement with the mean BCVA change of 0.3 logMAR in the whole sample, whereas the dominant eye BCVA only improved significantly in the isometropic amblyopia group. Additionally, 85% patients showed improvement in the stereo acuity, including 11 who had unmeasurable stereopsis before the therapy, although the p-value for this was not statistically significant. Binocular function improved in 6 out of 16 subjects who had pre-therapy suppression, and there was an overall average BCVA improvement by 3 logMAR lines in the whole sample. So to conclude, it's a viable and non-invasive alternative. It has shown improvements in visual acuity, stereopsis, and binocular function, and it enhances patient adherence and outcomes. It's a promising step forward to treat amblyopia and binocular vision anomalies. Thank you for your kind attention.
Ma'am, could we go back to the slide where you're showing us isometropic and an isometropic improvement
Yes, sir.
with the p-values. Yeah. Uh, you are saying that the improvement, see, if it's 0.46 to 0.24 and 0.55 to 0.30,
Yeah,
isn't
right.
it?
Yes, sir.
So that seems to improve by 0.25, has a spread of 0.29, 0.25. So roughly the same kind of a data spread out.
Yes, sir.
And this is 0.22. So 0.22
Yeah,
to
right.
0.25.
Yes, sir. Yes, sir.
Clinically, probably, we're trying to stretch it too far. It's just that they're almost similar. So
Yes, sir.
isometropia
Yes.
and isometropia.
Yes, sir. We
You said
actually compared both the groups.
yeah, no, no. You made an observation that
Yes, sir.
it is more in isometropic.
Yes, yes, definitely.
It is
In
almost equal in both the groups according to your data here.
but we have compared the dominant and the non-dominant also. The non-dominant eye showed improvement in the both. But
Okay.
individually, if we see in the in the isometropic group, the dominant eye seems to work better.
Okay.
So
So
we have
basically now we've
this
got a
data is
situation.
for both the eyes
This is
binocularly.
okay.
This
This
one,
is
yeah.
and so basically we need to look at a subgroup analysis of
Yes,
of
actually, sir.
the dominant eye.
Yes, sir.
So
So actually,
yeah.
there are multiple arms, and we have been trying to correlate many of them. But these are our
Yeah,
primary
that's what I was
results.
saying. You see, dichoptics is like very happening. The problem is there is too much choice,
Yes.
too many things going on, so it's very difficult to compare different algorithms.
And we have other patients also enrolled, but they have undergone similar therapy like patching previously. So to prevent any confounding factor, we have just confined these 31 patients who have just received binox therapy. That's all.
Yeah, so it's very interesting that I think we need more studies coming in.
Yes, sir.
I think we're hopelessly short on time. Anybody has any questions? Any of the speakers, you want to ask a question to any of the speakers?
Thank you.
Thank you so